Good evening and welcome to the Ombudsman program. My name is Diane Wellborn. I am the Ombudsman and I'm also going to be your host for this evening's program. Tonight we are going to be talking about the importance of collaboration in our community, and particularly collaboration to assist our elderly residents here in Montgomery County. And to help explain what has been going on, I have two guests this evening who have been involved in an interesting process since last June to develop new ways and new collaborations in which we can protect our elderly citizens. I have with me here tonight Linda Rupkin, who is the Executive Director of Life Essentials. Thank you for coming. I'll let you say a little bit about what they do in just a minute. And then I also have with me Gary Weston, who is the Senior Attorney at Legal Aid of Western Ohio. So thanks to you both for coming on the program. I appreciate it very much.
Thanks for having us.
Yes. Linda, why don't you say a bit about Life Essentials so people will know what your organization does?
Well, at Life Essentials, we serve primarily adults with mental illness and mental incapacities in Montgomery primarily, and some in Greene counties. We have two unique programs. One is our guardianship program, where we offer services to adults who have been deemed incompetent through a probate court, where we offer them an advocate, a guardian, to protect and preserve their rights. And then our CHUMS program is for seniors who are over 50 years old and have an identified mental illness. And this is a peer type program where they come together for camaraderie and learning, and we have really great outcomes, and people enjoy that program. They develop friendships, hence the name CHUMS.
That's a very valuable service provided to people who greatly need it. So thank you. How long have you been in existence?
Life Essentials have been around, this is our 26th year.
Okay, good, good, great. And now, Gary, I'll turn to you to say a little bit to our audience about the work of Legal Aid of Western Ohio.
Thanks, Diane. Legal Aid of Western Ohio is a nonprofit law firm. Yeah. We're designed to help low-income people mostly, and then seniors, 60 years of age and older, with civil legal problems. That could be anything from landlord-tenant problems, health and public benefit issues, domestic violence. There's a range of issues that we're able to help folks with, and we actually serve a 32-county area from Dayton all the way up to Toledo. Okay,
very good. Thank you. Now, Linda, I'm going to come back to you because you are serving now as the co-coordinator of the Collaborative Against Abuse, Neglect, and Exploitation of the Elderly, which is commonly referred to as Kane. And since you have become the co-coordinator, I'll let you tell our viewers a little bit about what the history of Kane has been.
Well, sure, my pleasure. Kane, as you said, is the Collaboration Against Abuse, Neglect, and Exploitation, and it started about 8 years ago. And the mission was really to bring parties together with interests in solving and preventing elder abuse, neglect, and exploitation in our community. So we, it's not really a division, but it's a project, if you will, of Job and Family Services and Adult Protective Services. So they developed this idea of how can we work together. There are all these senior service agencies in our community. We're all on the same side, but sometimes it looks like we're playing on different teams. So this collaboration was developed as the brainchild of the founder, Patrick Bailey, who worked in that office at that time, and sought out some startup money, worked with some experts around the country to say what collaborations work in communities, and started this group, as you said, that we call the Kane for short. So 8 years ago when this all started, there were some committees Under that, they worked on education, advocacy, criminal justice. They did case reviews, as well as community resources available to seniors in our community. And they developed a mission statement, which I'll read because I don't have it committed to memory. So the mission was to develop a collaborative partnership to prevent and eliminate elder abuse, neglect, and exploitation of older and vulnerable adults through comprehensive and effective education, advocacy, and intervention services. And here, 8 years later, we're still working on that, but through this last 6 months, we've really, and we'll talk more about that, worked on a big stakeholder series to gather a lot of information, which we want to share with your audience tonight.
Great. Thank you very much for that overview. Gary, how long has your organization been involved with the Kane?
Well, I think we were actually one of the first organizations, along with a couple dozen other organizations that have really been active in Kane for the last 8 or 9 years since it's been up and running.
Yeah, good. And you?
Life Essentials, I believe, is there since the beginning. My predecessor was active in the Kane meetings until her retirement, and then I came along.
Okay. And the Ombudsman's office has also been a member of Kane since the beginning. So, and there are others, probably too many for me to be able to name without leaving somebody else out. So I'll be safe with that and not try to list them. But we will come back and talk with our viewers about who are the members of the Kane and who does participate. But before we do that, I would like to say that the reason why we're doing the program tonight is because we just have finished this grand stakeholder series. So I'm going to turn to you, Gary, to say, let you give our viewers an overview of what we've been up to since last June with this committee.
Thanks, Diane. I'd be really happy to do that. But before describing exactly what we did, I think I just spend a moment in terms of why we did this, because I think that is helpful to know, which is we looked at some of the statistics, we heard some of the horrible stories of what was happening with regard to some of the abuse and exploitation of some of our elders, and Kane actually had a Data and Needs Committee, which I know you're aware of since you were one of the members of that committee. And looking at the statistics early in 2018, we realized this was not only a very significant problem, but a growing problem. Statistics show about 1 out of every 10 elders are victims of abuse, neglect, and exploitation. Some of the victimization is on the rise. There's more schemes and scams where folks are losing all of their assets. One national study suggested the cost of this to our country is around $36 billion every year. So we decided at Kane that engaging all the stakeholders in the community to share information, what are we seeing, what do we know, who has resources to help prevent, detect, investigate, correct the problems, that would be really useful. And we decided to embark upon a 6-month series where we would invite some of the key organizations and just about everyone who could be part of the solution.
Good. That's wonderful. Yes, it's a growing problem. Excuse me. It's a growing problem, and it is a population that is growing too. So you put those two things together, and we have a serious issue right here in Montgomery County.
And let me, if I might, describe kind of how we organized this stakeholder series. We had a kickoff in June at an opening meeting, and Commissioner Judy Dodge welcomed about 80 folks from many different organizations, and we had some great presentations. You did a presentation, Monica Walker from the Attorney General's office, and others kind of gave an overview in terms of the nature and extent of the problem, the statistics, the strategies that were being used, some of the ways we maybe could team up more. And that really, I think, got people enthusiastic about coming back and learning more. Then in the month of July, we had a session on financial exploitation. And that provided some very dramatic and sad stories. The United States Secret Service, for example, came and talked in terms of some of the victims they had worked with who had lost everything through different schemes and scams over the computer or other ways they were tricked. And we had some of the local credit unions talk in terms of some of the not only problems they were seeing with their customers, but some of the steps they were beginning to take to try to prevent and resolve some of the problems earlier than later. And one of the interesting things then also was the fact the law has changed. Some of the folks in the financial industry, as of September of this year, became mandatory reporters under Ohio law. So they now have an obligation to, in fact, report to Adult Protective Services if they suspect there is elder exploitation happening. Then, in the month of August, we had several of the public agencies, the public organizations that either have responsibility or special authority to be investigating and responding to abuse, neglect, and exploitation, present a lot of really helpful information. That included the Montgomery County Probate Court, the Adult Protective Services, Job and Family Service Division from the state of Ohio, and others, just in terms of explaining what their role is, what their responsibility is, what authority they have under law, and some of the resources they have, and how either seniors who are experiencing or at risk can connect with them, or their families and stakeholders and others. And again, all of this to help us as a community really work together even more closely to deal with this problem in a collaborative approach.
Right.
And I'll just continue.
Yeah, well, I was only going to comment that that we learned from so many of those stories the dramatic impact that this has on people's lives. And we also learned from the stories and the statistics that many elders are embarrassed to admit that this has happened to them, sometimes because it's one of their family members that is taking money from them, or they're just embarrassed that they were caught in a scheme, that they fell for it. So please.
Absolutely. And by the way, I think hopefully we'll have a little time while we're together this evening to talk about some of the recommendations that came out of the series. And one of the recommendations made was that we should further engage some seniors as peers, maybe in a peer network, because some of the seniors who are at risk may be particularly able to better understand the risks and to take some steps if they're working with similarly situated folks who can work with them one-on-one. So I sort of jumped ahead to where we landed at the end, but if I can, let me tell you about a few of the other really interesting sessions. So we had a session in the month of September on innovations, and that to me was a real eye-opener, because we had some of our local jurisdictions who really are leading the way in terms of developing some innovative programs to work with seniors to help prevent and resolve some of these issues. So, for example, the City of Kettering has a Safe Seniors program, and Vicki Carrer, who's the director of that program, gave a lot of helpful information in terms of how they work with some of the seniors, especially at risk, who may be experiencing dementia or some health issues, and to help them be in position for first responders and other personnel to come and help them in certain situations. And that's through having lock boxes to get into the house under certain circumstances where maybe the senior cannot call for help, and have the senior identify emergency contacts and a range of other services. But that was really very interesting. And then in Washington Township, there's a program called the STAR program, and Jeff Gray, who's a retired deputy Montgomery County Sheriff, runs that program and does just a wonderful job with over 100 seniors in Washington Township, connecting with them to help them with some of the resources that they need, and to work with them to be sure they can prevent victimization if that's possible, and to be connecting with emergency services and others should the need arise.
I would just also add that that prevention piece is so important, because often when the money's gone, it's gone. You can't get it back from these schemes and things.
Right. And the other thing, very quickly, that was interesting also at our innovation session is Reach Out of Montgomery County is working very closely with Jefferson Township, and one of the problems they're trying to address there is a lot of the seniors who may have health issues don't necessarily have doctors close by and tend to have to go to one of the hospitals and emergency rooms, maybe in Dayton. And the program that we learned about at this session connected community, fire, and other, paramedics to help get that senior some of the things they need in their own home to prevent very expensive and maybe dangerous, health gaps.
Yes.
And in any event, we were learning a lot along the way through the various sessions. And the last session we had, prior to kind of wrapping it up and coming up with some recommendations and action steps for the future, was a session about connecting seniors to services. And we had, I think, some very wonderful presentations by some of the organizations like the Area Agency on Aging and United Way and others, in terms of how they connect older individuals with some of the resources they need. And the Senior Resource Connection and St. Mary Connect also gave great examples of how they're working with individual older folks to identify what are the services and resources they really need to either prevent or resolve, these exploitation and abuse situations.
Wonderful. And at each of these sessions, there were upwards of 50 people from different agencies represented. So there really was a good community participation, and we're grateful for that.
I think we probably had over 300 individuals actually attend one or all of the sessions from something like 70 or 80 different organizations.
Right, so there were a lot of people.
Definitely a community and collaborative approach to this.
And I think what that demonstrates is just how many organizations are in our community that are interested in serving and protecting our seniors. And keeping vulnerable people safe, and more importantly, keeping people in their homes. I mean, that's the primary goal. So we want people safe in their homes. We want them to have access to resources, whether it's food, whether it's medication, whether it's doctors and transportations. Everyone in that room was really focused on the same thing. We know we live in an aging community. 10,000 people a day turn 65 in this country, and we're living longer lives than we've ever lived. So like you said at the beginning of the program, Diane, we are getting older, and there's more of us and fewer people under the age of 19. So we've got to, as a community, come together and figure out how we're going to take care of one another as we age.
And it is most interesting, I think, in the piece on innovations, how different communities have found their own route to deal with what they are presented with. In Kettering, the position does a lot with referrals from the EMT and police services who come into contact with people in need, whereas in Washington Township, it's a real outreach program to go to people's homes and talk with them and answer their questions about, should I do this or should I do that, and to help them understand that. So there's a lot of creativity out there in this, and it's good to bring that together.
And Diane, speaking of that creativity and following up on Linda's point, I think some of the recommendations that the stakeholders came up with at the end of this series really were responsive to that. And one of those I mentioned earlier was this idea of a peer network, and the idea being that we have a great resource in our community being human beings, especially maybe older individuals themselves who aren't working a full-time job but would love to contribute. And one way possibly is to somehow organize them, whether that's through a peer network or some other way, the problem of isolation of some of our seniors who maybe are not as connected as they need to be to other resources and services, kind of organizing senior volunteers and others, maybe in conjunction with their faith-based organization, or maybe in other ways, was one of the great ideas, and it certainly can build on some of the innovations that we also heard about during the series.
Right, exactly. And with that peer network would be a fun thing for us to see in our community, so people could be helping one another with those types of issues. We then concluded the final part of the series, then broke all of the recommendations and suggestions down into 3 broad categories of ideas. And Linda, I'll turn to you to tell us a little bit about the recommendations from the group that it was concerned with advocacy and collaborations and systems. And then we will follow with information about public education, and then finally maximizing resources. So, advocacy, collaboration, and systems.
So as a result of the stakeholder meetings that Gary talked about and shared with you, we drilled down to 3 basic themes. And one of those themes is really 3 themes, but we jumbled them together because we ran out of space. But they were similar enough that they could be one theme, and that was advocacy, collaboration, and systems. And so what we did is we took at the end of every stakeholder session, we ask participants to fill out a survey, if you will, and ask questions and put down ideas, and we took all of those sheets of paper, and I believe your staff recorded all those, transcribed all those, so we could get information and group them into these themes. And so with that, we came up with recommendations. And so under advocacy, collaboration, and systems, we really wanted to identify ways to strengthen collaborations in our community. We know there are collaborative partners. The Kane is one collaborative partner, but then there are lots of people out there in silos, and we want to bring them together. So one of the recommendations for that is to invite any organization, nonprofit, for-profit, government, banking, anyone that's interested in the health and safety of seniors in our community to become a member of the Kane. That membership is free, there's no fee to belong, it's a once-a-month meeting, and we can talk and share ideas on how best to serve seniors in our community. And then the other thing that we're going to do, okay, so Kane has a website, is we're going to put a list of all the member agencies on the Kane's website, so anyone has access to that, and hopefully there'll be live links so you can link to other organizations and find out more.
Can I ask you to pause a moment?
Yes.
Because I'm being told that we do have a caller that has a question or comment. Yes, we'd like to hear your comment or question. You're on the air.
Thank you. This is such an important topic for the show, and important work that your organization is doing to protect the elderly. My question is a complex one, I suppose. The 2 cases of elder abuse that I have experienced in the last few years, one that of a neighbor, the other that of a family member, were cases where in the first case a politician, in the second case, a religious leader worked their way into the confidence of the elder, and then eventually obtained very large amounts of money from both persons. And when this finally came to light, it was too late to do much about it. That's the complexity of financial financial abuse, and I would be grateful for any insight you can offer.
Thank you. Thank you. We will get an answer to that question. I am being told we have yet another caller on the line, so we have that question out and we will answer it. But we'd like now to hear from our second caller. You're on the air.
Thank you. I was wondering, and I apologize if this has already been answered, but I was curious to find out the role of Kane Collaboration when it comes to seniors being exploited. Say, for example, maybe it's a family member who is caring for one of their family senior members, and there's some exploitation with their Social Security.
Okay, thank you very much. We'll also get an answer to that question as well. Thank you for your call. All right, let's go back to the first one. How do we prevent financial exploitation? It's a huge question, and it's difficult to answer, but we do have some answers.
Well, I'd be happy to share some thoughts on the first caller's questions. Obviously, we don't know about this specific situation and wouldn't be able to address that. But the idea that someone can potentially be exploited by anyone, by someone who they believe is a loved one, they believe is working in their best interest. Unfortunately, some of the people who are perpetrating the abuse, exploitation, and victimization of elders are often using a relationship or pretending to be looking for the best interest. So one of the things, and this certainly is something Kane has been working on for years and is intensifying, I think, with some of the recommendations and hopefully action we'll be able to take, is do some very strong education for each and every senior in the community and their loved ones and people who are working with them. First of all, to let them better understand what the risks are. That even someone who seems to be very trustworthy, they're knocking on your door, they're your new best friend, they say, there is a risk. So it's incredibly important to work with people who you're only absolutely sure are trustworthy, but also build in some controls, build in some safety measures. Get help from legal aid or some of the other service providers in the community to understand how you can do that, to understand if you make someone your agent under a power of attorney, or you give them access to your bank account, or you let them close enough to help. They could also be in a position to harm you. So these can be very complex situations, and that's why we need to not only work together, but work as a community to get that education and to get those tools on the ground to the individuals who are at risk or have already experienced being victims.
Yes, that's very good. There have also recently been developed by the state of Ohio some guidelines that that if the caller would be interested in calling into the Ombudsman's office, we can put them in touch via the web to those resources. So they are accessible. We can also get printed copies for those who don't use the internet. So that's available, and then one can also contact legal aid, and I'll give you a chance to talk about your session on Plan Ahead and Protect Yourself that is available through your agency.
Well, thanks, Diane. On the Plan Ahead and Protect Yourself project, and that is something Legal Aid has partnered with many organizations in the community, including Kane. We have put together a series of 5 classes, which what we think are some of the most important information for older people to know about not only what their legal rights are, but what resources exist to help with legal issues, and how to protect yourself. We have one class, Keeping Seniors Safe, another class on financial power of attorney, and more, which covers a range of ways someone could get help on their financial matters, but also, if they don't do it the right way, be harmed and lose everything. So those classes are available, and you can get in touch with Legal Aid to find out more. The other thing, going back to the questions from the callers and kind of what Kane is doing in general, it's very important if we as a community can publicize who does have the ability to help under different circumstances. So Adult Protective Services has some responsibility and some authority under law to be investigating situations where it looks like there is someone who is exploiting another. And in fact, many individuals have an obligation under law to be reporting that by calling Adult Protective Services, and they can investigate. The prosecutor's office has the ability to be investigating and, where appropriate, bringing criminal charges. There are many things that the probate court has the authority to look into and resolve. There's a range of possible solutions, but I think the threshold is just making people know this is a real problem in the community and helping to spread the word on how it can be prevented or detected early, and in that case, how people can get help.
Right. And did you want to comment on that, Linda, before I make another?
It's easy to become, it's like the caller said, and it made me think of how the term con man developed. He said they gained, the people that he knew who were exploited, people they trusted, they gained confidence, the confidence of the victim. And that's how it happens. You're confident that my power of attorney isn't going to, take any money away from me or borrow my money, and that oftentimes these things develop and snowball and get out of control. So as Gary said, it is so important to have those checks and balances in place to protect yourself. And there are agencies and attorneys and organizations that can help you do those things, right, including legal aid.
Right. And I think I was just going to add that the point of the Kane is that no matter which agency an individual calls to start to report this, that members of the Kane have now learned and they know what is the right place to call. So at this point, in response to both of the callers, because the second question was about the role of the Kane in becoming involved in a case where somebody suspects that there's exploitation of someone's Social Security benefits, that somebody else is getting them, misusing them, exploiting the person. So in that specific instance, if the person with the suspicion were to call your office, Linda, then you would be able to direct them to the appropriate place to go. If they were to call my office, we could do the same. If they called legal aid, you could do the same. So I think that no matter what agency within the Kane is called, they know how to help direct people to APS if it's needed, or whatever other entity needs to be involved.
And I agree, and I think that is the most important agency available and a good starting place when anyone suspects abuse or neglect or exploitation, is to get a hold of Adult Protective Services. They have a 24-hour hotline. They have to investigate within a certain amount of time, and I know from my own business dealings with Adult Protective Services, even if it doesn't warrant more criminal action, they will try to help people get the services that they need.
Right.
And this might be a good time to mention also some of the tools that Kane has been using throughout the years, and that are included in the recommendations in these various areas. One of which is what we call the case conferencing or case review approach, which I think is really valuable for doing some of the things we just talked about. Better understanding among our various organizations and systems who really can help with certain kinds of things and what a solution might be. So the way this works, just quickly stated, is anyone who is in the Kane can kind of bring to the case review group on a very confidential basis, where we do not use names or any identifying individual about the person who has the issue or we're trying to help, a scenario where one would have the opportunity to talk with other experts from other agencies, other systems, where you can pick into the expertise of a lawyer, a doctor, a counselor, an ombudsman, an adult protective service worker, et cetera, and get not only ideas on what resources might exist to help in this situation, but some of the strategies or some of the approaches you might not have thought of on your own. And I think this, too, is a great example of collaboration. And it's certainly a recommendation that has come out of our stakeholder series, that getting more people at the table and being able to tap into this great expertise is helpful for individuals, and it's also helpful to identify how we as a community can do this, systematically to deal with the issues.
Thank you for bringing that up. These are called, I-teams for short, but yes, they meet on a regular basis. Let's run back now to the advocacy and collaboration and systems recommendations.
So I pretty much talked about the collaboration recommendations. The other one is systems, and that recommendation was to bring like-serving organizations together. Gary talked about the innovative session, where in Kettering they're doing this, in Washington Township they're doing that, in Jefferson Township they're doing that. So if we could convene municipalities to talk about the senior services that municipality offers, that's convening like organizations. And so we thought that was really would be a beneficial thing for the Kane to do. And then lastly is advocacy, and how can we really advocate for our seniors, but have our seniors and their families advocate for themselves. And that's to really just work on educating the community like we're doing now. And so what we found is that a number of our topics overlapped. So even though this is under advocacy, education kind of begets advocacy. So really teaching people about what elder abuse is, how to get help, how to go to adult protective services, to make a case for yourself or your loved one.
Yes, very good. Thank you. The second category that we had was recommendations about doing more public education. You just touched on that public education, but were there more that you feel like our viewers should be informed about?
There were a few more. So again, educating seniors on preventing elder abuse and educating our seniors on how not to become victims. Educating the community on what laws exist and where to get help, as well as having professionals that people can reach out to get advice and direction and resources.
Good. Thank you very much. We also, on the last section, we developed recommendations for maximizing the resources that we have available to address this growing problem. So, Gary, would you like to give us some of those?
Sure, Diane, I'd be happy to. And we've actually already touched upon a couple of those as we've been talking, the idea of possibly tapping into some of the volunteers so we have in the community, maybe through a peer network. Asking everyone in the community to be active in Kane and participate in the committees, whether that's education, to spread the word about risk, problem causes, and solutions, or whether that's to participate in the case conferencing. There's a lot of ways that we can use our community resources efficiently if we team up, and Kane is a great place to do that. And of course, in terms of some of the educational programs we have in the community, we could probably do that efficiently if we kind of figure out in Kane who's doing what. We thought that having an annual session for our elected officials who may not fully know about all the great work and resources that exist, plus some of the challenges, would be extremely helpful. And another resource recommendation is it takes some staff, and it takes someone to kind of do the legwork to bring a collaboration together and to have minutes done and information on the website and such. So having at least some staff support for that would be extremely valuable. And of course, having some funding to do that is something that Kane thinks would be extremely advantageous. And also sharing some of the information about best practices. We already touched upon some of the things that our different municipalities are doing, and being able to replicate or adapt that in other communities would be a great use of resources. So that was one of the recommendations out of the resource committee. And I probably missed a couple. Well, those are some of the main ones.
We'll probably then come back to talk about those a little bit more. I think that overall we probably want the viewers to know that anyone and everyone is welcome to come participate in the Kane. I think you've each said that in your own way tonight. But would you like to inform the viewers when and where the meetings take place?
Oh, Diane. We meet on the fourth Wednesday of the month at 8:30 in the morning at Montgomery County Job Family Services at the Job Center. Right. In conference room 1133.
Yes, correct.
So it's a standing meeting. You don't have to have an invitation. You just come. There are usually signs posted. The Job Center is a big building, so depending on where you park, you might have to walk a little bit, so you might want to get there just a few minutes early to allow for that, but on the fourth Wednesday of the month, we'll be there.
Okay, very good. Yes, it is a big building, but they have been very good with signs, and I'm certain that anyone who comes in and asks will find their way to the Kane. They'll make sure to get them there. Let's go back and talk a little bit about how viewers can later have access to the information that that we are putting on the website. Let's say a little bit more about how all of the pieces of this have been placed.
Well, we do have a website, and the easiest way to find that for me is to just Google Kane, that's capital C-A-A-N-E, which, as we talked about, stands for Collaboration Against Abuse, Neglect, and Exploitation, Montgomery County. So if you were to put Kane, Montgomery County, you will see the first thing that pop up will be the Kane website, and if you click on that, there is a wealth of information, including quite a bit of material from the 6 stakeholder sessions we had in 2018. And as we develop new things, which we talked about, Linda mentioned earlier the resource list. And I think we also have a question and answer document with some of the key questions that have arisen during our stakeholder series, and people are wondering about. That too would be posted, as well as the dates and location of the meetings, in case someone forgot what Linda just said in terms of the fourth Wednesday of the month, room 1133. Go to the Kane website, and that should be there as well.
Good, good. Yes, I would inform the viewers tonight that we had literally hundreds of questions that came out from these 6 stakeholders series. So probably there's a good chance that when the question list is up, that any questions our viewers might have will be found on this, some of which we are still working to try to get answers to, which showed that they were very good and challenging questions for us to go back and to work on. So the Kane meets monthly, and then the I-Team, or the case conferencing, is also planning to be meeting monthly, resuming sometime after the next Kane meeting in January. And so any agency or entity that has a scenario that they would want to submit to the Kane for consideration is welcome to do that, and to submit it through either any of the 3 of us sitting here now, and then we would in turn be sending that to Adult Protective Services, because it is a staff person from Adult Protective Services who's chairing that particular committee. So did you want to say anything more about the I-Teams? Because I think that's a very key component of what we're doing, and maybe could be stressed a little bit more, that it is a multidisciplinary team, as you said, and the cases are real. We don't give real names, of course, to protect the confidentiality of the individuals, but the cases are real, and the solutions that we're looking for are real as well. So.
Well, just a couple more thoughts from me, Diane, one of which is, as Linda well explained, Montgomery County was well ahead of the game by creating a multidisciplinary team about 8 years ago to bring together people from all kinds of different places to work collaboratively on this. And now the state of Ohio, within the last couple years, has actually adopted requirement where all the counties should be having an interdisciplinary, or as you refer to it, I-team, to do a range of things collaboratively to prevent or help, resolve abuse, neglect, and exploitation. And the case conferencing or case review is an important feature of that. The thing that I also wanted to add is, as we have finished the stakeholder series, but resume the monthly meetings of Kane, now with, I think, significantly more organizations that are on board to kind of be active members of the team. I think that when 2019 begins, we will be revisiting what committees are active, and there'll be an opportunity for people to join committees, and some of the recommendations are things people could kind of roll up their sleeves and work on. Isn't that right, Linda? Because I know you are the co-chair of Kane.
I am.
I should say along with Dwayne.
Along with Dwayne Woods, who Director of Senior Services in Montgomery County. The two of them are the leaders of Kane at this point in time.
And I think that's what's really interesting and unique about our collaboration is the I-team is a mandate of the state, of the county to have this function where they look at problems with seniors through an interdisciplinary approach. And then Montgomery County, being the leader in this, took it even farther and developed this huge collaboration. And we're all sitting here talking about Kane, and we're not county employees. So that's how important this collaboration has become to our community, and there's a lot of buy-in and support from the county. Montgomery County has been a great supporter of this and is really proud of the work that our community has all done, essentially as volunteers on a great big committee. And so it's special, and we invite you to come, and we know that the committees will be reconvening. There will be an advocacy committee, the case conference, as well as an educational committee to start with. We know that those will be the first 3 committees.
Right. And I would also add that the interest of the financial community in these instances of abuse and exploitation was tremendous. We really had a large interest there, and many people step forward who want to try to figure out how to assist, because they may see something and they want to know how to stop it. And so there have been guidelines developed for people in the financial community as well. So that brings in, it's not just social service types. It's it's a much broader team. We had law enforcement there who were interested. We had first responders come to this. So there's something in Kane for almost every type of profession, I would say. Yeah. All right. I also wanted to let us say a moment about what some of our favorite aspects of the work of the Kane have been. I don't know if you have a case that you want to report or something that you found particularly exciting that we can share.
Well, I would mention something that I've particularly enjoyed and I think has been worthwhile, which is the fact that Kane has had an elder abuse awareness event every year going back in time. And for me and legal aid, this has also been an opportunity for our organization to use our Plan Ahead, Protect Yourself project and some of the resources that we have for seniors to a place with about 20 or 25 other Kane members to make this not only really interesting and fun, but hopefully useful for seniors in terms of preventing or dealing with abuse and exploitation. So this event has been held the last couple of years at the Trotwood YMCA. And we had the opportunity to have what we call a virtual classroom where we set up a bank of about 5 or 6 computers, and any senior who would like to can sit down and watch a short video class, 5, 6, 7 minutes, to learn more about how to keep themselves safe or how to avoid the dangers of financial exploitation. And we make it fun with some incentives and prizes, and there are a lot of other Kane members there to pass out very helpful information to the attendees, and their food, and some of the elected officials and others attend this event. So this is just one example of something positive Kane has done that's really been fun, but also really useful for the seniors in our community.
Right.
And I'm guessing we'll be doing things like that in the future as well.
I feel confident we will, because June is Elder Abuse Awareness Month, and so this is the time when that usually happens.
For me, I would say it has really been the stakeholders meeting. When anything is around for as long as Kane has been around, it tends to maybe get a little tired. And so this stakeholder series has reinvigorated the group as a whole and brought in new thoughts and new members. And I think that we're going to be ready to launch in January with much more invigoration and power. And so for me, that's been what I think is the greatest. And then the other thing is to learn about resources in our community that I didn't know existed. Like one that I think everyone was, I can't speak for everyone, but a lot of people I know were tickled by was the fact that there's a Secret Service office here in Dayton, Ohio, and that they work on this diligently. They work on protecting seniors against financial exploitation, right. And so that was really a good thing.
Right, and some of those stories were very difficult and somewhat heartbreaking, that the area where they're working is on a lot of those scams, where somebody is using a computer and getting to an elder and gaining their confidence, and then draining their bank account and asking for more and more and more money. And so they're on top of trying to monitor and look at those and stop those. So I also think that back at the beginning of the Kane, one of the things that may not have been put out into our community beforehand were the facts and the numbers and the statistics. I think it had been some time since that had been highlighted in our community, just how pervasive the abuse and exploitation of elders is. And I remember the one clip that they had from Mickey Rooney, who was saying that, if this could happen, if it could happen to Mickey Rooney, it could happen to anybody. So that was a very, very powerful clip that we don't have with us here tonight, but it's out there and it's available.
And if anyone would want to Google Last Will and Embezzlement, that's the name of the film, and we just showed the trailer. But that is a great example. If it can happen to Mickey Rooney, it can probably happen to any senior, and it's happening right here in our community,
that's right.
Unfortunately.
Yeah.
And it's so heartbreaking when it happens when the perpetrator is a family member. If you're familiar at all with Brooke Astor, she was a socialite in New York City, and her son and his wife took her for millions of dollars. She was a philanthropist. She was living in squalor until her grandson soon sued his own father to be able to rescue her.
Right, so sometimes it takes that. But we're going to end on a happier note, because we have a couple of minutes left in the program, but what we really want to stress to viewers tonight is that there are resources in the community to help fight this and to help stop this. And 3 of us are sitting here, and we are members of the Kane, and there are probably 40, 50 agencies that are participating in the Kane at any one time, participated in the stakeholder session. So there are resources to help, excuse me, in reaching out to any of the organizations we've mentioned. APS, Ombudsman's Office, Legal Aid, Life Essentials can get you started and can get you connected to the right person if you know of somebody, or even if you suspect somebody is being abused or neglected. We have very short time left, but in seconds, do you have any final remarks you'd like to leave the viewers with?
If you think something isn't right, it probably isn't right. call someone, call APS, call the police.
Okay, good. Gary?
Connect with the resources that exist in the community, and I think we're all going to be working together to solve this problem.
Great. Thank you both very much for coming on the program. I appreciate all this good information, and I thank the viewers and the callers. Good night.